I spoke earlier to Nick Hopkinson, Chairman of Action on Smoking and Health and Professor of Respiratory Medicine at Imperial College, and Christopher Snowdon, Head of Lifestyle Economics at the Institute of Economic Affairs. And I began by asking Nick what he makes of the government's plans.
The smoke-free generation policy, taking steps to help prevent people from starting smoking in the first place is an incredibly positive step forward for public health. Smoking is uniquely lethal. It's incredibly addictive. Most people, more than 80% of people, start when they're still in their teens. So by essentially making it more difficult to start, by making it illegal to sell cigarettes to people at a steadily increasing age, we'll stop people from ever starting. So I think it's an incredibly sensible, forward-thinking measure to improve the nation's health and wealth.
And I'm going to bring in Christopher in just a moment, but what about banning disposable vapes as well?
So there are two really important messages around vaping. One is that it is much less harmful than smoking. So for people who smoke and want to reduce their risk of premature death and of premature disability, switching from smoking to vaping is a really useful way to do that, to reduce the risk. But it's certainly not completely risk-free, and we don't want children and young people taking this up.
Christopher, what do you make of all of this?
Well, with regards to the gradual smoking prohibition, I just believe that adults should have the right to buy tobacco and smoke it, and that they should always have that right in the future. So I'm going to fundamentally disagree with Nick on that. On the vaping stuff, and it's not just the disposable vapes, unfortunately, there is other stuff in there. The UK has gone from being probably the best country when it comes to regulating vaping and has been very successful in driving down smoking rates as a result, to being one of the worst if all this goes through. The disposable vape thing is interesting because, it is undeniable, I think, that the rise in youth vaping in the last 3 years or so has been largely led by the disposable vapes. However, the vast majority of people who use them, 2.6 million adults, are grown-ups. And, I gave up smoking 12 years ago or something using the old school first-generation vapes. And I've tried to get various smokers to try them and to switch over, and some do, but many haven't. And what's been amazing has been seeing how many people have just been picking up the disposables, which don't take any knowledge or expertise, no fiddling around, no refilling, no recharging, and they've really been very successful. And we're throwing the baby out with the bathwater with this. I can't think of any other product that will be banned just because children sometimes are able to buy them. I think we should be enforcing the laws against underage sales rather than stopping everybody from buying these products.
But we know that vapes do still contain nicotine. So if you allow young people to have them, Christopher, or you allow people even perhaps when they reach the age of 18 or 16 to have them, you are exposing them to health risks, aren't you?
Well, not through nicotine directly, actually. But yes, no one's saying that vapes are safe, but I'm not saying let children get their hands on them. I'm saying the opposite. I'm saying let's start enforcing the law that's been in the books for nearly 10 years and start putting out some serious fines to unscrupulous retailers who are not only selling vapes to kids, they're often selling illegal vapes to kids. What people don't understand is there's been a glut of cheap, brightly coloured disposables coming in from China, partly because actually the Chinese Communist Party has itself banned e-cigarette flavours in China, and they're flooding the market with often unregulated and illegal vapes. They, in turn, are being sold illegally in corner shops to minors. And it's quite difficult these days to buy a bottle of vodka or a pack of cigarettes if you're under the age of 18. It seems to be all too easy to buy a vape.
Nick, what would you say to that? That actually the government should just be enforcing the laws as they stand, which mean that children should not be getting these disposable vapes, and that we're throwing the baby out with the bathwater because we're going to be depriving a lot of people who might be able to stop smoking through vaping?
Well, as I sort of said at the start, it's really important that effective vaping products are available for adult smokers who want to use them as a way to quit smoking. So there are
because just to clarify that, sorry to interrupt, Nick, but the point is the government's not banning vaping altogether, is it? It's just the disposable ones, and then just stopping the sale of some of these flavours that are particularly marketed at children.
Yes, so the government has been very enthusiastic about the idea of vaping as a harm reduction strategy for smokers, and there is it's funding a sort of swap to stop scheme so that in smoking cessation services they will be people provided with sort of e-cigarette starter kits. Now, there are certainly people who find it difficult to use non-disposable devices, and that's something that the regulations will need to think about to make sure that adult smokers in certain contexts may be able to get access to disposable devices. But in general, the reusable ones are preferable. Because they for the environmental point of view, and also because that they're a little bit more expensive and not at pocket money prices. So dealing with the disposables, I think, is practical, and it's also youth vaping or children vaping is a real problem. I mean, we think of it a lot relative to smoking, and it certainly isn't as harmful as smoking. But children are particularly vulnerable. Their lungs are developing, so there's risk of harm from what they're inhaling in vapor as well as from cigarettes. And the harms of vaping are likely to accumulate over a long period of time. So the best way to stop people from being exposed to vaping for 10, 20, 30, 40 years is if they never start in the first place. So as well as the sort of we know what's worked for smoking in children, because particularly since the turn of the century, there've been a range of laws and regulations and so on around marketing, packaging, prices increased, smoke-free legislation, so on, that has brought youth smoking right down from kind of 20% at the turn of the century to about no more than 3% of early teens are smokers now. So we kind of know what works, and it's the same. I think the thing is for children and young people vaping. We need to reduce the availability and the affordability and the appeal of vaping, and I think the measures that the government's proposing will do that.
Let me turn to this idea of smoking-free generations in future. Christopher, I mean, this is something that was announced at the Conservative Party conference. Clearly, there are some on the right of the party, including the former leader Liz Truss, who are opposed to the measure. How do you think it is going to play out politically? Because people do know the harms of smoking, don't they? I mean, that is something that we really have learned over the years, and increasingly the rules and the laws on when and where you can smoke have tightened and tightened. Do you think that perhaps this could be something that allows Rishi Sunak to show, well, he is prepared to take a tough stance on something he's prepared to believe in?
Well, I think it's a flailing attempt to generate some sort of legacy for himself, possibly. I don't think there's anything brave about it. I mean, there's nothing brave about kicking smokers, and it hasn't been in this country for 20 or 30 years. It's the easiest thing in the world to give smokers another kicking. It's particularly easy when they're not even smokers yet and they're not even adults yet. Okay, so this is something that won't have any teeth at all until 2027 at the earliest. A lot of people seem to find it hard to imagine someone who's 14 now being 24 in 10 years' time, but that's the reality. The absurdity of this policy will only become manifest in about 5 or 10 years' time, at which point I fully expect the public health lobby to say, actually, you know what, this is quite absurd. Let's just ban smoking for everybody. And they'll say, we're going to give you 12 months to switch to vaping or give up or use nicotine pouches. But that's it. From January the 1st, it's all over. We're banning it. And finally, the anti-smoking lobby will get what they've always secretly wanted.
What do you think of that, Nick? Because it will require a future government to continue to pursue this policy for it to work. Rishi Sunak may perhaps win another term in power, but in a sense, it is the kind of measure that requires cross-party agreement for it to be delivered in future and enforced in future, isn't it?
Well, I'm honestly slightly taken aback that Chris from the Institute of Economic Affairs, which of course has received hundreds of thousands of pounds of funding from the tobacco industry, is proposing a total ban, because that's certainly not something that the tobacco control community broadly are calling for. But
I don't think that's quite what Christopher was saying. Christopher, just explain your point, and then I'll come back to you, Nick.
Yeah, I'm not proposing it. I'm just predicting it based on the psychology of prohibitionist public health. It's fairly obvious where this has been going for a very long time. And I'm sure when they finish with tobacco, by the way, they'll try to ban vaping. In fact, we've already seen today the first baby steps in that direction. All this stuff about, smoking's uniquely dangerous. Well, why are we now applying exactly the same policies? As Nick's just said before, he said we're going to emulate this now. We've seen what works for smoking. We're going to do exactly the same thing with vaping and alcohol and fatty food and goodness knows what else. It is endless.
Nick?
Well, in 20 years ago, when 20% of people age 15 were smoking, that was illegal. So, nevertheless, they were still smoking. So, in terms of the policies that will prevent, the illegal consumption of vape products by children, which we're all opposed to, I hope, then the policies that the government is suggesting are likely to do that. Young people going into shops are seeing huge racks of displays of vape products, and they are and they're packaged and marketed in a way that's obviously intended to be appealing to children and young people. It's obviously the industry model is to get people addicted to nicotine so they continue to be consumers, and they've done that with their previous incredibly effective and incredibly lethal device, the cigarette, and they'd like to do the same thing with vaping. Now, for people who are already smoking, switching to vaping is much less harmful, but we don't want people to out of nothing take up vaping if they need not have done.
Well, why not? It's none of your business. If an adult wants to take up vaping, what's it got to do with you?
Well, we're talking about children.
No, you said anyone. We don't want anyone to take up vaping.
Well, I don't think it's particularly desirable for non-smoking adults to take it up. But
how do you know? How do you know what's desirable for another adult? I vape all the time, and I'm very happy doing so. You're telling me I'd be happier, I'd be healthier in some way? It's none of your business. Do you not see that?
Well, we're drifting off the subject. It's not
really. No, it's absolutely fundamental, because the question was about liberty.
If we want to discuss, different views of freedom, you spent the last decade or two advancing the freedom to smoke. Other people advance the freedom to live a life of adequate length that's not subject to an addiction starting in childhood that kills 2 out of 3 people that continue to smoke.
Well, that was Nick Hopkinson, Chairman of Action on Smoking and Health. He's also Professor of Respiratory Medicine at Imperial College. And Christopher Snowdon, Head of Lifestyle Economics at the Institute of Economic Affairs, speaking to me just a little earlier here on Times Radio.
Listen to Times Radio.